Hi, it's good to be with you again. I'm here with you today to close out my 180-day plan that we established together back in April of this year. 2017 was a great year for the Central Texas Veterans Healthcare System, but it's time for us to also set our sights on fiscal year 18 with the tasks that we have ahead. So let's talk about the 180-day plan, the objectives that we identified together, where we are with each one of them, and then we'll talk a little bit about fiscal year 18. So the items in the 180-day plan, of which many of you are aware, included things like improving the way we operate as a healthcare system, increasing the amount of accountability and the level of accountability in our organization, to do what we can together to improve the veteran and employee experience. We talked about enhancing our scheduling oversight processes. We also talked quite a bit about engineering service and your ideas on what engineering could do to improve its customer service in the organization. We also talked about our recruitment processes and what we could do to streamline those, as well as improving our strategic and space planning activities in the organization. We talked a little bit about housekeeping, and last but definitely not least, looking at our labor and management relationship and finding opportunities to improve it. So we'll talk a little about the specific initiatives that we worked on together under each one of those priorities. So first was improving our need to operate as a healthcare system. And we've done a couple things in the past year to address that concern. The first was establishing a new assistant director position at our Austin outpatient clinic. That position will put Austin on parity with Waco, where we'll have an assistant director, my representative, at each one of those campuses. We've already classified that assistant director position, and I look forward to it announcing very soon. Many of you have seen the acting assistant directors that we've had, which included Mr. Greg Varentis, Rob Farias, and soon a new gentleman by the name of Sean Ryan will be joining us from the Houston VA Medical Center. Also under the category of improving how we operate as a healthcare system, we talked about what I refer to as PACT optimization, which was improving how we function in our primary care teams across our healthcare system. I set a goal that by September 30th, 25% of our 80 PACT teams would be optimized, which meant they had access within 7 days when looking at their third next available appointment. I'm pleased to share with you that we exceeded my goal thanks to many of you and your leadership in primary care, including individuals such as Dr. Bendella. As of today, October 24th, 30% of our PACT teams are optimized. Which means they have access within 7 days. And that number jumps to about 42% if we look at access within the next 10 days. So we continue to make progress in primary care thanks to many of you for your efforts. We also talked about provider productivity under improving how we operate as a healthcare system to standardize how we capture workload and to ensure that we're getting the most out of our most expensive human resource. So I set a target that by the end of the fiscal year, all of our subspecialties, of which there were 4 that I'll talk about in a moment, would exceed the 25th percentile of their respective comparison group overall productivity. We didn't quite meet that goal, but we met 50% of it. When we initially established that goal, we had 4 practices that I was paying close attention to. Those included ENT, dermatology, vascular surgery, and urology. I want to start by congratulating urology and vascular surgery, which both met my performance expectation and exceeded the 25th percentile for their VHA comparison group facilities. So congratulations to you and for your outstanding efforts. Dermatology just missed the mark by 1%, finishing at the 24th percentile, but still a very good job, and look forward to dermatology continuing its upward trajectory. We also talked quite a bit about accountability and improving the level of accountability in our organization. As I shared with you in my previous video, in June, the Secretary and the President signed a new law referred to as the Accountability Act. This law gives VA leaders the ability, if necessary, to take appropriate action on individuals who are not living up to our organization's performance expectations or our organization's values. I have used that act to take actions when I thought they were necessary. But let me make clear that my intent is not to use the Accountability Act to inappropriately discipline or remove individuals from our organization. But I do expect leaders in the organization to ensure that they are applying these new authorities when it's determined appropriate to ensure that our organization can meet the needs of our veterans and of our nation. So we also talked about the veteran experience and the employee experience and doing what we can to improve each of those. Many of you know that in FY17 I held a number of focus groups in partnership with AFGE, both our local chapters here in Temple as well as our AFGE partner in Waco. Those focus groups were well attended, a lot of really good feedback, and those services that hold the employees that we've met with are actively working on action plans to improve the working environment in those services. The FY17 All-Employee Survey scores are slowly coming in. As of today, I have not received the final report, but I've received some preliminary data that gives me a global view of what our employees told us was important to them going forward. And the categories that you identified for me were accountability again, things that the organization could do to address your need for personal growth and development in your current roles, as well as improving organizational recognition and praise for our employees. So we'll be talking more about those as we get the service level results and can engage both you and your leadership and our labor partners to develop action plans that we can work on in FY18. Under improving the veteran and employee experience, we also talked about positive news stories and getting those positive stories out. Some of you may have noticed on our homepage, you'll now see a link to a YouTube channel that we've created thanks to our public affairs service. So if you click that link, you'll have an opportunity to view a myriad of positive stories about our organization, and we're also sharing those positive stories with other stakeholders. Some of you may have also seen some of those same positive news stories showing in our waiting areas on televisions. And for that, I want to thank medical media as, again, we continue to look for opportunities to share with our veterans and our staff some of the great things that are going on in our organization. We also held a number of town halls during FY17. Those were obviously employee town halls. We had a number of veteran focus groups, but we also had a number of telephonic town halls, a new thing for Central Texas, where for each one of our sites we called thousands of veterans at one time and had the opportunity as a senior leadership team and as a service leadership team to talk with those veterans and to ask them questions that they could respond to interactively and tell us if they were satisfied with the customer service that they receive at our facilities, if they were satisfied with their access to care, satisfied with their perception of their primary care provider, and to tell us things like whether or not our clinical teams were communicating things to them in a way they can understand. Our veterans really love those town halls, those telephonic town halls, and so I'll continue to do those in FY18 with the expectation that during the course of the year, every site in Central Texas Veterans Healthcare System will have at least one telephone town hall with their veterans that we can all participate in. So we also talked about scheduling oversight, and as many of you are aware, on August 6th, our outpatient medical support assistants that were under medical administration service were realigned from medical administration service to the services that they supported. Now, as a result of that change, although we're very early, we've already seen very positive impacts on accuracy of scheduling, as well as improvements in those same services for things like telephone responsiveness. And veterans are noticing it. I'm getting to speak to their directors where they're telling me that they're seeing a difference in the organization. So thanks to those of you who were impacted by that change, and I appreciate your patience as we continue to work through that transition. But I also want to clarify that MAS does still hold a very critical scheduling role for this organization, which includes manning our call center, which at the moment is scheduling primary care appointments and is setting benchmarks nationally for performance and their response rate. MAS will also continue to do our initial training for any new schedulers that join the organization. So we also talked about engineering service. Specifically, you had some questions about engineering customer service and their responsiveness to your needs. I want to thank our assistant director in Waco, Amy Maynard, as well as our engineering service for actively engaging that concern, sending you a survey that we got a number of responses to, and engineering is actively working that action plan specific to your concerns. But we also talked briefly under the category of engineering about modernizing our facility, and though we've had engineering complete a number of projects during FY17, what you may see now as you're viewing this video, if you were to walk the halls on the first floor of the Temple campus, a significant amount of work that's begun on our Halls and Walls project that we also talked about. So we'll be watching as the organization transforms with up-to-date finishes on our walls, as well as new flooring that'll be going into the organization. So I'm sure you will appreciate those changes, and thanks to engineering for making that happen. We also talked about our recruitment and onboarding processes. HR has had a very successful year. We brought on hundreds of new employees to help us continue to meet our mission as an organization. However, we are following through on your request to review that hiring process to ensure that it's as smooth as possible. So we have chartered a systems redesign project that we've referred to as Speed to Hire, and so we'll continue to give you updates as that project proceeds. We also talked about our strategic planning and space planning activities. In August, we had one of our first strategic planning summits that was specific for our community-based outpatient clinics. And as a result of that strategic planning summit, I've approved new services that are going to be added at a number of our community-based outpatient clinics. Services such as audiologists on site and optometrists on site. These are services that we've identified as foundational for the Central Texas Veterans Healthcare System to ensure that veterans in those areas have the same opportunity for these high-use services that veterans in Austin, Temple, and Waco have access to. So I look forward to working with our strategic planner and our leadership at those community-based outpatient clinics as we begin to expand those services. We talked briefly about housekeeping services. I don't have much to update you on in this regard at the moment, but I will let you know that during the course of FY18, we will see a lot of activity in the area of housekeeping, so we'll keep you up to date as we have more information to share. Last but not least, I want to talk to you briefly about our labor and management relations, which you asked us to look at and to find opportunities to improve. One of the things that we've done is rolled out a new supervisors academy. And I want to thank Human Resources, our labor partners, and our Associate Director, Andrew Garcia, for helping move this forward. That academy is active now, and it has been incorporated into our executive career field or performance evaluation models, where I've set as an expectation that every supervisor in the organization is required to go through this training. There are core hours and there are elective hours, with the expectation that during the course of FY18, every supervisor in this organization will have at least 20 hours of training. That will ensure that we understand our labor master agreement and that we understand other important things for supervisors to know, like process improvement and lean management, and how to praise and recognize our employees. So I look forward to the success of that initiative, and thank you in advance for your participation. So that really sunsets the 180-day plan, really a plan that was intended to position Central Texas to compete well in the next fiscal year, which we are currently starting, fiscal year 18. Although we had a few other successes in FY17 I want to touch on outside of the 180-day plan. Those included achieving our 3-star SAIL designation, which is an outstanding achievement for Central Texas Veterans Healthcare System. Not just a 3-star, but a top 3-star organization on the verge of becoming a 4-star organization. This transition has been due in large part to things like reductions in our readmission rate, decreased lengths of stay in our organization for inpatients, a remarkable improvement in our mental health veterans' perception of the care they're receiving in mental health. So this is coming to us from our veterans. Also significant improvements in the mental health quality indicators. We've seen reduced mortality rates, improvements in our HEDIS and ORIX measure compliance, as well as achieving top-tier inpatient satisfaction scores, which means across VHA, Central Texas has been identified as one of the best performing for veteran inpatient satisfaction. So a lot of really good successes there that we expect to continue in FY18. We also had a myriad of accreditations. I don't have the time to tell them all to you, but these included things like CARF, the Long-Term Care Institute, as well as a recent survey with the Joint Commission that was also highly successful. We opened a call center that I talked to you about earlier that's setting performance benchmarks for VHA. We've established an integrative case management program that's been nationally recognized. We get calls on almost a daily basis asking what we've done with the integrated case management program, which has had significant impacts on things like our readmission rate that I just mentioned to you. We've also significantly decreased the number of veterans that we have waiting beyond 30 days for care, while at the same time improving how we have coordinated care for veterans in the community, all of which have been recognized at the national level. So again, we have plenty to be proud of with accomplishments in FY18, but our work continues. So let me briefly walk you through the priorities of VHA, and then a few in specific that I'd like to tell you a little bit more about and how they relate to Central Texas. So our Secretary, David Shulkin, has outlined 5 very clear priorities for VHA. Those include greater choice for veterans, looking to modernize our systems, focusing resources more efficiently, improving the timeliness of our services, and suicide prevention. I want to talk to you briefly about 3 of these and how important they're going to be for Central Texas in FY18. First is the strategy of greater choice for veterans. One thing that we all need to understand is that the Secretary has indicated that greater choice for VHA means greater competition. What we've referred to historically as choice will soon be renamed to care, and you'll learn more about that as necessary. But this is likely to allow veterans greater choice as to where they receive their care. If we want to compete in this new environment, we have to be accessible. So you'll continue to hear me talk about access, and we'll have to continue to be veteran-centric and engage our patients both when they're in our halls and walls and when they're outside in the community to ensure that they know that we will always be here for them. We have to be a 4-star organization or better. If veterans are going to be given the option to choose where they receive their care, we want the choice to be VA. And it should be very difficult for a veteran to decide not to come to the Central Texas Veterans Healthcare System. So again, we'll need to position ourselves to compete in an atmosphere of greater choice. We will continue to modernize our system. You've heard me talk to you briefly about the Halls and Walls projects we have ongoing, but there'll be many other projects in FY18, including parking lots that will open, a parking garage that will begin design. We'll have boiler plant projects that are in design, administrative buildings that will begin to design and move into construction. We have CLC renovations that will begin in Waco, and a second MRI that we'll be installing in Austin. We'll be moving forward with a new location for our Cedar Park outpatient clinic and establishing Vision 17's first primary care telehealth hub. So a lot of activity in Central Texas over the next year, which I look forward to working with you all on. The last one I want to talk to you about is the Secretary's priority of focusing resources more efficiently. So in FY18, I will formally launch our lean journey. So what does this mean? This means as an organization, we need to invest in systems redesign. We need to invest in improving our lean culture. We are growing, and we're growing rapidly as a healthcare system, but we need to ensure that those dollars that are allocated to us are going to direct patient care as much as possible, which means we'll have to look closer at our patient care processes and at our administrative processes to ensure that we're operating efficiently and effectively and using our taxpayer resources to the best of our ability. So with that, I want to thank you for making FY17 a success for the Central Texas Veterans Healthcare System, and I look forward to making FY18 an even better year. Thank you again for choosing Central Texas.